to see so many friendly faces today. And if you're just joining us, then please do sort of let us know in the chat kind of where you're from today. It's great to welcome you. And I'm going to have Sarah Holiday, which is our guest speaker today, and he's very kindly sort of fit us in and speak to you all about menopause health. So without further ado, just a bit of background. So you're joining today because your organization is taking part in what's called our Kenton Medway Healthy Workplaces program. So that's a free workplace wellbeing scheme that's open to businesses in Kenton Medway. And part of the program is that we deliver employee webinars. So like this menopause health one, and we do have a range of other webinars that we do. So we've got sort of financial wellbeing, men's health coming up, just to name a few. And I put them in the chat just now if you do want to have a check out of those. But that's why you're here today, and we've got lots of sort of questions. So while we've sort of disabled microphones just to make sure that the recording audio is all right, please do feel to put any questions that you have as we go along in the chat. And at the end of today's session, we'll sort of make sure that we cover as many as we can. And if we don't cover all of them, we'll put it into a document to share after today's session with all of the slides, the link to the recording, any additional resources and things like that. So do feel free, make yourself comfortable, and we'll crack on now. I'll go ahead and pass it on to Sarah. Oh, sorry, one final thing I forgot to say is disclaimer. So everyone's experience during the menopause can vary greatly, so it is important to speak to your GP if you feel like your symptoms are negatively affecting the quality of your life. And because we have so many different workplaces here today, it's important to also appreciate that different organizations might have different structures and support in place. So to check out, speak to your organization around what support they can offer as well. And while this webinar is sort of an introduction to menopause, we also know that it can influence an individual's health and well-being and any sort of healthy lifestyle behaviors that they're looking to get support with. So again, check with your organization to see what support's available at your specific kind of workplace. Now I'll go ahead and pass it on to Sarah.
Good afternoon, everyone, and I'm going to start by saying Happy World Menopause Day. Woohoo! It's obviously a lot bigger than it's ever been before, and I'm really happy and feel very lucky to be able to deliver this presentation to you all today. So obviously our hashtag for World Menopause Day this year is continuing the conversation, whereas a while ago it was let's start the conversation. So thank goodness we're talking about it, and let's keep talking about it. My name is Sarah Holiday. I'm a physical activity specialist for the Public Health Department at Medway Council, and I also have a specialism in women's health. So that's why I've sort of taken it on board to deliver all the menopause awareness sessions in Medway. And yeah, next slide, please. Let's get going. Welcome, everyone. So in this presentation, I will refer to women, although the topics covered can also affect those who were assigned female at birth. So everyone with a female reproductive system who identifies as a man but hasn't undergone any medical interventions is likely to go through the menopause. Just think it's really important to start with that. Next slide, please. So why do we need to start the conversation around menopause? It is not just a women's issue. Men and partners can feel confused, unprepared by this life transition, and for too long it has remained a taboo subject and it has been masked by myth and metaphor. 38% of partners say they feel helpless when it comes to supporting their partner through the menopause. And 28% of partners say they often end up having arguments because they don't understand. And these statistics are from the British Menopause Society. And also, I'd like to state that a lot of divorces happen around this transition, transition in life. Next slide, please. Oh, I just pressed my arrow down as if I was going to do next slide. So how can the menopause affect our lives? 80% of women will experience symptoms of hormone fluctuations during the menopause transitions. More than a third of women experience severe menopause symptoms that impact on their quality of life. 3/4 of women in the UK say that the menopause has caused them to change their lives, and more than half say it has had a negative impact on their life. Some of those being that they've actually decided that they need to change careers because they feel incapable of doing the job that they've always done. A third of women experience long-term symptoms, and 1 in 5 women's symptoms will be mild. But on average, some women do have no symptoms, but on average, a woman will have up to 7 symptoms. It's quite a lot to take on. Next slide, please. So let's have a little brief talk about what the menopause is. So it's not a medical condition, it's a biological change that has health associated risks. It is classed that you are postmenopause when you have had no period for 12 months. So that's like the medical line. Normally occurs in women between the ages of 45 and 55. That does differ. Average age in the UK for the menopause is 51. 80% of women are menopausal by 54. Premature menopause is before the age of 40. Early menopause between the ages of 40 and 45, and it affects women very differently. When we say early menopause or premature menopause, it can be because it's surgically, people have had to have a hysterectomy, maybe they've had cancer and cancer treatments have brought on the menopause. So that's what we mean by the premature menopause. But every woman will go through it, and this is why we need to have this conversation. Next slide, please. So the perimenopause, never really heard about it much. It's usually the word menopause that we hear about. But the word perimenopause are the years leading up to the menopause. Generally, it starts around the 40s, but it can start in your 30s, maybe your late 30s, and it can last for 2 to 14 years. So these are the years where your estrogen starts to decline and you start to possibly get the symptoms of the menopause. Hormones are fluctuating, they start to go all over the place. Ovulation cycles become irregular. It can be a mirror image of puberty, and most of your symptoms will occur at this stage. So during this 2 to 14 years, this is where we find we're having the most symptoms. Now, in the 1900s, the life expectancy was 48. In 2016, the life expectancy is 82 years. So now you think about the changes of our life expectancy, we could be living a third of our life menopausal. And if we think about it, 13 million women in the UK are menopausal. Next slide, please. A little bit about hormones. So the word hormone, it comes from Greece. It's a Greek word meaning messenger. So we think of hormones as a messaging system that works throughout the bloodstream. They affect everything. Hormones affect everything. Our brain, our bones, our muscles, absolutely everything that you can think of, hormones have a part to play. Maintains your heart health, promotes your bone health, helps with your joints, pelvic floor as well, mental focus, clarity, and mood. And the hormones that we think about, the main hormones that are your messengers, are your estrogen, your progesterone, testosterone, cortisol, and insulin. Next slide, please. So estrogen. Estrogen is the name of a group of hormones. Estradiol is produced in the ovaries and it's the most potent. Estrogen is cardioprotective, so it helps maintain your heart health, promotes bone health, supports collagen within your skin, helps memory, production of serotonin. It has over 300 functions in our body. And this is why we start to have the symptoms that we're having as we go through the menopause, the perimenopause, our estrogen declines. Not always the first hormone to decline. Some people find it's progesterone, but estrogen is the main one that starts to decline over a period of time. Some people's estrogen declines quite rapidly. Some people have a gradual decline. Next slide, please. So progesterone regulates our cycle, prepares the body for pregnancy, ensures that there isn't excess estrogen in the body. So on the slide before, we had a picture of grass. It wasn't randomly put there. It's to show that estrogen is the hormone of growth. Progesterone keeps estrogen in check. So it cuts it down when there's too much of it. It's sleep promoting. It promotes the feeling of calmness and anxiety, helps moderate pain tolerance, and this hormone tends to be the first hormone to decline. And when we start to get onto symptoms, you'll see that a lot of the symptoms people are reporting are anxiety, sleep deprivation, and also feeling like they're having a lot of pain in their joints and muscles. Next slide, please. Moving on to testosterone. So this isn't just a male hormone. We actually produce more testosterone than men. It helps maintain our energy levels and our mood, supports our bone density, so the strengthness of our bones, supports cognitive function, so brilliant for brain health, and also supports our muscle health. So it's not just a male hormone. And we've said that the declining in hormones, particularly the estrogen, that can have an adverse effect on our heart health, brain health, bone health, and pelvic health. Next slide, please. So, what can happen when our hormones start to fluctuate during the perimenopause? What is happening to our body? What are the symptoms that we might be experiencing? Hot flushes or night sweats. So, not just feeling warm, it's a hot flush. It's a sudden urge of heat. It comes up from our feet. It can take over our body. It feels like we're just consumed with heat all of a sudden. Some people get them very severe. Some people have a panic attack before the hot flush comes on. Everybody is different. Weight gain can also happen during the perimenopause, or the inability to lose weight. Insomnia, lack of sleep, not being able to get to sleep, or waking up quite a few times throughout the evening. Anxiety, fatigue, not just feeling tired, but an absolute exhaustion, the crashing out feeling. Irregular periods, itchy skin. So people say that it feels like something's crawling all over them. Mood swings, dysmenorrhea, which is very painful periods. Panic attacks, palpitations. Next slide, please. And there's more. Sorry, there's a few of these, but we will talk about how we can help ourselves. So increased pain, constipation, but can also be the other way. So diarrhea, loose bowels, loss of confidence, brain fog, delayed verbal memory, forgetfulness, not remembering where you've put the keys, where have you parked your car, loss of concentration. People have reported bloating, headaches, feeling oversensitive about things that might not have bothered them before. Or, I'm afraid, reflux disease. People start to have allergies that they may not have had before. Suddenly not being able to have certain antibiotics. Some people start to have allergies to grass, like hay fever, some asthmas as well. Altered taste, so your taste buds change. Some people suffer with teeth grinding, can be linked to the anxiety. Dry mouth, increased risk of gum disease, and that's why it's really important to make sure you're keeping up with your dental checkups and your hygienist appointments. And 45% of women suffer with urogenital atrophy, which is your vaginal dryness or incontinence. But not many people talk about these symptoms. Some people don't link them to the menopause, don't realize. Some people think, oh gosh, I'm going mad. I feel like I'm going mad. I don't know myself anymore. Why can't I remember where I parked my car? These symptoms might not be linked to the menopause, but they can be. And this is why we always talk about tracking what's happening to you at the moment. Next slide, please, Catherine. So hot flushes, the main reported symptom when you're going through the perimenopause. So approximately 75% of women will experience hot flushes. It's the body's reaction to a decrease in estrogen. It disrupts the hypothalamus, which is at the base of your brain, and this is what regulates your body temperature. And so it leads to a hot flush. You can't regulate your temperature. 25% of women can still be experiencing hot flushes long term, so postmenopausal. So after the periods have stopped, after that 12-month point, people can still be experiencing hot flushes. Also, I just wanted to add that if you are under 50, it's 2 years period free. So it's slightly different dependent on your age. Okay, next slide, please. So the most commonly reported triggers of hot flushes: stress and emotional situations, the external heat, so the heat in the environment. A few weeks ago, it might be months ago now, when we had the really hot weather, people were very suffering, not just with the heat, but also having a hot flush in that heat as well. Confining spaces. Alcohol is a massive trigger for hot flushes. I'm afraid alcohol is not your friend if you suffer with hot flushes. And caffeine. So hot drinks, like tea and coffee, caffeinated drinks, these are a trigger for a hot flush. But your triggers might be very different. Some people say hot food, hot spicy food can also be a trigger. So again, we would recommend that you track your triggers. Write down, have a weekly calendar, which I think we give out in our resource pack at the end, so that you can track what you've eaten, and see if there are any triggers for your hot flush that you can avoid, or try to tweak so that the severity of the hot flushes aren't as high. Next slide, please. So muscle and joint pain is also reported as a symptom. All of a sudden, you start to feel your joints are hurting. You feel more stiff as you wake up in the morning, and this is because the estrogen is protecting and stabilizing your joints and muscles. So as that estrogen declines, you can be more susceptible to more muscle and pain. The main areas that have been reported are plantar fasciitis, so the pain in the bottom of the feet, hip pain, and also shoulder pain. Next slide, please. Mental health during the menopause. 20% of women have difficulty with memory and concentration, and 23% of women feel more isolated. And again, these are stats from the British Menopause Society. And it's due to the fluctuating hormones. The brain struggles to deal with the stress. These hormones fluctuate, and this causes a disturbance to the HPA axis, which can lead to an increased risk for depression, anxiety, feeling sad or tearful, or the heightened stress, the extra sensitivity that maybe you didn't feel during situations that you now feel. Next slide, please. Sleep is very common when it comes to menopausal symptoms. Hot flushes has always been top of the table, but sleep is really coming up there. A lot of people have reported that they're suffering with sleep disturbances more than hot flushes. But dependent on what research you look at, it tells you slightly different. But I would say they're on par at the moment. So this is due to the hormones fluctuating, but also the increased stress on your body. Poor quality of sleep can also lead to weight gain. So even though hormones can have an impact on your weight, your hormones changing, it's usually the effects of the symptoms from the menopause that are your barriers to losing weight or the inability to lose weight. If you're feeling tired, if you have hardly had any sleep, You wake up, you're feeling terrible in yourself, you might reach for the caffeine, you might reach for foods throughout the day that you think are going to give you energy, and therefore you're consuming maybe too many calories or the wrong type of food. So this will obviously creep on the weight or stop you losing the weight where you may have easily before. So sleep is a massive one to think about. Poor quality of sleep. Sorry, we don't sleep when the brain interprets that a stress and signals the release of cortisol. So obviously, stress makes us to crave the foods that are high in sugar and fat, which drives the belly fat. And we then have weight gain and also insulin resistance. We also, during the menopause, we change from, we have like a slightly weaker estrogen that is produced, and this is produced in like the fatty tissue. So, this is another reason why we start to hold fat around the middle. Next slide, please. So let's think about sleep and how we can help ourselves. Um, some people enjoy meditation, some people it's not for them, but meditation can really help. Even certain apps that you can use on your phone just to help with breathing techniques. So, not quite meditation, but breathing techniques, body awareness techniques. Some people like the smell of lavender, some people can't stand it, but lavender is proven to help with sleep. You can get lavender sprays for your pillow. You can also get lavender that you put into like diffusers to fill the room. Physical activity in natural daylight. So getting out in the daytime, especially on a day like this. I don't know what it's like where you are, but it's beautiful blue skies and sunshine. So trying to get out, even if it is just for 10 minutes, being out in natural daylight will help you sleep. Restorative yoga in the evening can be really beneficial, even if it's breathing and gentle stretches. Think about maybe a sleep routine, like a child would have or a baby, winding down, low lighting, relaxing bath, maybe no stimulants, no alcohol, no caffeine before bed. Um, can we think about what our bedroom is like? So, our setting of our bedroom. Or do we have a telly? Do we sit in bed watching telly? Do you have your laptop next to the bed or your mobile phone? Can you give yourself a curfew of no blue light 2 hours before bed? This will help your brain be able to close down and sleep better. And also sleep hygiene. What are you sleeping in? Do you clean your sheets regularly? Do you have cotton sheets? Are they breathable? What are you wearing to bed? Is it breathable material that if you are experiencing night sweats, you feel that this having a nicer set of pajamas or something lighter will help. So those breathable fabrics are key. Next slide, please. So we talk about tracking for triggers for hot flushes. You can track for the days that you might have poor sleep. Going back to sleep as well, I just want to say if you do wake up, um, waking up in the night time can be linked to your liver. So you usually your liver is very good at having to break down and get rid of toxins or let's say excess hormones that maybe our body doesn't need. If you're drinking alcohol or you're eating unhealthy food before you go to bed or having caffeine, your liver is spending its time when you sleep trying to break down all of that instead of breaking down those excess hormones. So have a think about the diet side of things as well before you sleep. Um, and also, um, I was listening to a talk from a sleep CBT sleep therapist, I think her title was, and she was actually saying that if you do wake up in the night and you're tossing and turning for half an hour to an hour trying to get back to sleep, the best thing to actually do is get out of bed, walk away from your bedroom, go downstairs, have a glass of water, time away from the bedroom, and then go back to the bedroom. You're more likely to be able to get back to sleep. So that was quite a ping light bulb moment, because I know we've done a lot of these talks before, and a lot of people said, "Well, what do you do? Do you just lay there like, oh, I need to get to sleep. I've only got 5 hours until I have to wake up, and what should I do?" So her recommendation, which is proven through research, is to walk away, take yourself away from the bedroom, and then come back maybe 30 minutes later. You're more likely to fall asleep. And be kind to yourself. Don't beat yourself up that you can't get to sleep, because then obviously it's that vicious cycle in your head. So, tracking menstrual health. So, as well as knowing things like our blood pressure and our heart rate and our weight measurement for our heart health, we should be starting to track our menstrual health. um, and the American College of I can never say this word. They state that our periods are the fifth vital sign to women's health and wellness. So, as well as your blood pressure and your heart rate, a healthy menstrual cycle is 25 to 35 days. An average cycle length should be 28, 29 days. A healthy period should be 3 to 7 days. Spotting might be for 1 to 2 days before. But if you're spotting in between periods, it's not normal, and we would advise you to go and see your GP. But what is your normal? Are you tracking your periods? Can you use an app on your phone to track your periods? Can you keep a note in your diary so that you know what your menstrual cycle is? We need to become our own experts on our menstrual health. And also dysmenorrhea, which we spoke about before, painful periods. We've always been, well, I have brought up to think that painful periods are just, that's just the card that you've been dealt. Um, and it's not. Painful periods to a certain point is normal, but if they are so painful that two painkillers aren't taking away the pain, it's actually not normal, and you shouldn't have to be putting up with it. So it might be the case that you need to go and see your GP to talk about your menstrual health, and ways that you can help with the pain that you're experiencing. Next slide, please. So the NICE guidelines, this was produced in 2015, but it has been updated recently. Um, I think it's crazy that this only came out in 2015. We've been here a very long time. Women over the age of 45, their diagnosis is based on age and symptoms. So you're not offered a blood test. Women aged 40 to 45, it's based on your symptoms, your menstrual cycle. So, another reason to track your menstrual cycle. You may be offered a blood test, but they don't have to offer you one. Women under the age of 40, they will look at your medical history. They will also want to know about your menstrual cycle, and you will be offered a blood test. Okay, so this is what the NICE guidelines say. NICE states that women should be given this information and advice. So whether this is happening or not, hopefully it will start to happen soon. So we should be given information about the menopause when you go to an appointment to talk about it. Also the stages of the menopause. The symptoms that you might be experiencing. So, a symptom tracker is a brilliant tool to start using, so that when you do go to a appointment to talk to a health professional, you've got your symptom tracker. You can show them the symptoms that you're experiencing, as well as your any triggers, and a menstrual health calendar as well. You should be offered information on lifestyle changes and any interventions that could help. So, in case of this, we're looking at diet. So, what nutrition advice could you be given? You should also be given advice on exercise. You should be given the advice on the benefits and risks of treatment, so HRT, but alternative methods are also available. The long term risk of menopause, so the cardiac risk and bone health. And also, it's really important to keep up to date with your national health screening. So, bowel health screening, mammograms, and also, like we said, your dental checkups and your hygienist appointments. Excuse me. Next slide, please. So let's have a think about what we can do to help our heart, brain, and bones. So a healthy heart goes hand in hand with a healthy brain and healthy bones. Get regular checkups, so high blood pressure checkups, diabetes checks. So if you are diabetic, make sure you're keeping up to date with those checkups, because high blood pressure, obesity, and diabetes are very harmful for brain health. Watch your weight with a healthy body mass index. Some people um, swear by using the BMI, some people don't. I always say think about how your clothes are fitting. If they're suddenly feeling quite tight, it might be that we need to incorporate some more exercise or look at dietary requirements. Know your numbers, which we've already spoke about, so your blood pressure, your pulse, and your waist measurement. Cut down on starchy, fatty, sugary foods. Eat plenty of fresh fruits and vegetables. And there's research to show that it's like a Mediterranean style diet, really easy to follow, or a plant based diet. A healthy lifestyle includes getting enough sleep and minimizing stress. So we need to think about what serves us and what doesn't. And what doesn't serve us in life, we need to start doing a bit of life laundry and getting rid of it so that we can concentrate on ourselves and our own well-being at this stage of life. If you are smoking, it's really important that you stop, because smoking is a massive trigger for a lot of symptoms, and obviously not good for your heart, not good for your brain either, or your bones. And also think about your alcohol intake. If alcohol is a trigger for some of your symptoms, it might be that you want to cut it out completely, or you might find that certain alcoholic drinks are better than others. But again, it's drinking in moderation, be safe, be alcohol aware. Next slide, please. So some strategies to help: engage in regular physical activity that gets your heart rate going. It doesn't need to be going to the gym for 2 hours. It could be getting out for a 30-minute walk on your lunch break. The guidelines are 150 minutes a week of moderate activity. So something that gets your breathing rate up slightly, but you can still talk and hold a conversation. 150 minutes over a week is 22 minutes a day. We have all got 22 minutes a day to do something, even if it's dancing around our kitchen, which could be classed as vigorous activity rather than moderate. Depends what music you dance to. Or you could do 30 minutes over 5 days. Physical activity can help offset the decline of bone mineral density and prevent osteoporosis. So strength training is really important, because osteoporosis is obviously a risk factor, and 1 in 2 women will become osteoporotic. Challenge and exercise your brain by learning new skills, reading, volunteering, stay connected. So, social engagement can boost your brain health. Find ways to be part of your local community and share quality time with family and friends. If you do, I read some statistics the other day about brain health, and if you did one workout, it can increase your focus and your concentration for 2 hours afterwards. So if you know you've got something that you really need to concentrate on, if you can go out for like a 30-minute walk beforehand, you're much more likely to be focused on the projects that you need to deliver. Next slide, please. So here's the guidelines that I mentioned already: 150 minutes of moderate intensity per week, or 75 minutes of vigorous intensity. So that crazy dancing if you're listening to some fast music. Also, we want to minimize the time that we're sat down. We need to break up our sitting, the periods that we're sat down for. We need to move around more. Think about the strengthening work, and also think about balance work. But you need to find something that you enjoy. There's no point trying to find an activity or throw yourself into an activity that you just do not want to go to, because you're not going to keep it up, and consistency is key. So find something you enjoy, buddy up with a friend or a partner or a family member, and go for a walk. Anything you enjoy doing is the best way to bring physical activity into your daily life. So when we're sat all day especially in certain office jobs. We're sat all day, we spend a lot of time sitting, we commute sitting, we might eat our lunch or our dinner sitting. We need to try and break up those periods of being sat down. Next slide, please. So, healthy lifestyle changes are key in this midlife transition. Menopause is a complex stage of life. It represents both a loss and a time for reappraise in one's life. So, sustaining fitness and activity at this point can be absolutely life changing when it comes to dealing with menopausal symptoms as well as overall well-being. And also, if you can find groups with people around, the same age, then people will be mainly doing exercise to help with menopausal symptoms. So again, it opens the conversation. The more people talk, the more we educate ourselves, the more knowledge that we can gain. It gives us more power for changes and support for the future. Next slide, please. So how can you help your self, but also support yourself, your colleagues, sorry, your friends and family? Start the conversation. So the more we talk about it, the better. Let's start to foster a culture of openness. It shouldn't be a taboo subject. We spoke about knowledge, getting as much knowledge as we can, educating, and also knowing our own bodies and our own minds. Giving ourselves the tools, or having the tools that we need to go to a doctor's appointment and not to be scared to ask for help. Um, Remember that menopause is just a transition. So it is a journey of high and lows, but it is a transition. It will come to an end, and there is light at the end of the tunnel. A lot of people say they feel happier, fitter, healthier, and clearer in their mind after going through the transition. So if you do want to learn more about the menopause, we do hold awareness sessions for all employees, including uh, managers awareness sessions, but that's mainly for Medway Council. Um, you can gain more knowledge during these sessions. It definitely delves in deeper. This is a bit of a whistle stop tour just to give you a little bit of awareness. But there are resources at the end of this that you can log on and see what else we're delivering in the area. But I mean, the Davina project has launched, hasn't it? So I think you will find a lot going on in your area as well. It can't be ignored anymore. So you should be able to find some more courses or webinars to help educate you. There's lots of resources out there on the NHS website. Women's Health Concern, Bupa's brilliant. Also the Balance app. So Louise Newson, she has a website and also a Balance app where you can track your menstrual cycle, you can track your symptoms, you can track triggers, and it also, at the end of so many months, I believe it gives you a health report of an overall of everything you've logged. And there's also a template letter on there that you can print off to take to your doctor. So it gives you more force or tools behind you when you do go to your appointment. Gives you the confidence as well. So there's lots of resources there. You'll get a copy of these slides so you can click onto all of these links. Next slide, please. There's some more resources. So obviously I'm a part of the physical activity team. We have walking groups running in Medway. We have Nordic walking groups running. We have an Everyday Active website now. So it's for Kent and Medway. You can go onto Everyday Active, put in the area that you live or you work in, and it will give you a list of everything that's going on in that area. There's also a menopause page on there too. So you can click on and have a look at that. We also deliver NHS health checks. I believe that's for over 40s, I think, or 45. But you can have your blood pressure checked, your heart rate checked. So you can go along to an NHS health check. We also have our stop smoking support teams, Kent and Medway, and also there's the NHS smoke free app. And there's so much on offer for our mental wellbeing, NHS talking therapy has been recommended before by somebody on a course. They said that they found that really useful. There are cognitive behavioral therapy sessions for sleep that actually really home in on sleep if that's one of the symptoms you're struggling with. And also Every Mind Matters, and we have cares first at Medway Council as well. Next slide, please.
Yeah, so we've
So
had
that's
a
me.
lot of questions come in, and we've had over 20 questions come in, Sarah. So I think
Okay,
what
I'll
we're going to
try to
have to
help.
do is a bit of a whistle stop, but then what we will do is put it into a Word document so we can give
Mhm.
sort of the right, proper attention to everyone's questions that put it in. What I have just done in the chat, and what you can do is scan the QR codes on your screen. When we put this session together, we kind of anecdotally felt like this was a really popular topic, or that it would be. But sometimes we sort of need the data to prove our points,
Yes,
and that's where the
please.
satisfaction survey comes in, that I've just put in the chat there. So if you could please, please, please have a click on the link there in the chat that says 2-minute anonymous survey. And then if you like this session and are interested in sort of future ones, we've got a whole dedicated session on sleep happening on October 26th, as well as some intro to financial well-being and men's health happening later in November. So again, the link to those webinar registrations are in the chat as well. I'm just going to stop screen sharing so we can try to do a few more questions, and just kind of do a bit of rapid fire to you, Sarah, if you're ready.
I'm ready. I'll try
All
and
right.
help where I can.
There were a few that kind of had a similar theme, which was if you're on birth control or contraception, either through the coil, a continuous pill, whatever it may be, how do you know if you have gone through the menopause?
You won't. If you're on any contraception, it masks you. It obviously changes your hormone levels, but it also masks you not having that period three of 12 months. So you won't know, but you may still have symptoms like perimenopausal symptoms that you would link to it, but there's not a way to know if you're on contraception. It's come
Yeah,
up
the
quite a
other
lot actually in that
question, and
question.
there's a quick question, is night sweats the same as hot flushes if they're happening at night, or is there different sort of criteria?
There's a slight difference. It depends if your if you're a hot flush, if you're waking up and you've had a hot flush, that is linked to the similar hot flushes in the day. Sometimes people have actually got adrenal fatigue, which is that you're having a night sweat and it's actually waking you up at night. So there's a slight difference between them. Um, I'd say if it's feeling different to what a hot flush would be and it's happening during the nighttime and not the daytime, it could be adrenal fatigue. You might want to go and see a health professional just to rule it out, or get some help when it comes to that.
Sorry, real quick, I did see that there was maybe the wrong survey link on the QR code, but the links that are in the chat just now, and I've just put it again in the chat, that's the correct link to the right survey. So if you still can do it, we appreciate it. And the other question we had was, again, sort of similar things of how do we get the most out of our GP appointments? So one, to make sure that they're kind of really listening to what we're saying, or two, how best to sort of make sure that we're being heard.
So I'd say be confident. You know your body better than anyone. Arm yourself with as much information as you can. Track everything. Track any symptoms that you have, which we will give you a diary for tracking. You can track your hot flushes. This is also on the Balance app. Track your menstrual cycle. Be confident that you know that this is happening to you. You are going through the transition and you want to know your options. Also, if you need to print out the nice guidance because it's there. That's exactly what we should be getting and we should be receiving. There might be like a somebody with an interest of women's health in your surgery, not always a doctor, maybe one of the nurses. So when you do ring up to make an appointment, ask if there's anyone in your surgery that specializes in that. And yeah, just record as much you can, and don't be don't feel unconfident. It is your body, changes are happening, and you want to know your options.
We do have a symptom tracker template as well as another sort of 4-week style template that is in our resources that we'll share with you after this. I'll try. I know we're sort of past time, so we completely understand if people need to go. But I thought maybe we'll try to answer maybe just a couple more. Some of them had some rapid fire ones. Was, can you go on HRT if you're perimenopausal? Yes or no?
If you're perimenopausal and you're having the symptoms, I believe you can go on HRT. Yes. Um, Again, HRT is a bit like contraception. So you sometimes people that start the pill don't always stay on the same pill the whole time. You have to find out what dose you need and what works best for you. But yes, if you're perimenopausal, this is the time you want to be on the on HRT or another method of medication, because this is the time that you're going to be experiencing the symptoms. When you hit your 12-month free period, it's your medical line, you're then classed as postmenopausal. So perimenopausal, if you're struggling with any of the symptoms, please go along to the doctor and see what help there is available to you.
Yeah, someone did just put, my GP won't prescribe HRT. If I'm postmenopausal, is there an alternative to use?
I'm not a medical professional, so I can't comment on it. But I was in a talk earlier this morning and somebody asked the same question. The lifestyle changes that you can make can have a massive impact on your health and well-being and any symptoms that you might have. Also, she was suggesting that there are other alternatives to HRT, which I can't talk about just because I'm not medically trained, but definitely go along because there are other alternatives available.
Yeah, we've got a resource that gives you just a good NHS overview of kind of around HRT and dispelling some of the myths. But it's very much like birth control. There's going to be sort of things that make you ineligible for it, things that
Hmm.
might help it, and sort of what types and how it's sort of absorbed through your body. So it is very specialized, and that's why you got to have that conversation with either that women's health specialist within your GP practice or your actual GP to kind of give you more personalized recommendations. But from an
Hmm.
overview point, we can point you in the right direction. I think the last question before we go is, we had someone who said, is it common to experience symptoms for 10 years?
Yes. If you think about the average time that we could be perimenopausal, it can go up to maybe 12 years. So sometimes people can experience symptoms before they realize that they're perimenopausal. So you might be getting headaches, you might start to just feel tired and have brain confusion, but you might think, oh, it's just because I'm really busy in life at the moment. And so you don't put it down to perimenopausal. So the stats that we gave you are those are the people that are reported, but there are so many people out there that have had the symptoms but don't even realize it's linked to the perimenopause.
Well, thank you all so much. I know we still have a few questions, but like we said, we had a really great engagement from you, so we just want to thank you again for that. And I've put them all into a Word document so we can try to adjust them wherever possible if it's within our scope of practice. And we'll send that out in the post-session email today. So in that email, you'll get a link to the unlisted YouTube recording of this session, the slide deck, that symptom tracker resource, and any other kind of resources that we think are relevant to the session. So I'll go ahead and stop the recording now, but if you do have any other questions, please, you can put them in the satisfaction survey and then we can address them in that Word document. But thank you all again so much for coming, and thank you to Sarah for a fantastic presentation.
Thank you. Thank you, everyone.